The big thing about, I guess, education about social media and online is that a lot of parents are on social media and are online themselves, but the difficulties that we face online are very similar to the ones that we face in our day-to-day as well, in the physical realm. So sometimes it can be a bit magnified maybe online, but it's the very same in terms of the difficulties that young people are faced with.
There has been a lot of controversy and uproar of late, and rightly so, surrounding the horribly long lists of children and young people waiting for an appointment with a child and adolescent mental health service. The Limerick Post speaks to Dr Cian Aherne, clinical psychologist by background and clinical coordinator with Jigsaw Limerick, about the mental health services on offer in Limerick for young people, the role Jigsaw plays within Limerick, and the impact of social media.
Jigsaw Limerick is a mental health service for 12 to 25-year-olds in Limerick, and we've been open for supporting young people since June last year, 2017. So we offer like an early intervention prevention service where our main goal is to try and get to difficulties before they get more complex or severe, or like you said, like an emergency situation. At the same time, it has happened where people have been experiencing kind of immediately difficult levels of distress. In those situations, we just try to connect them with a next of kin first and foremost. We also link strongly with other organisations in Limerick, such as CAMS, Pieta House, GPs.
There are many services around Limerick offering mental health help. However, in the evening there seems to just be online or phone help.
I know that there aren't kind of emergency all-night services, but there are actually a whole load of services in Limerick that maybe people don't have as much of an awareness of. For example, we work really closely with the Limerick Social Services Counselling Service and the Limerick Youth Service, who both have psychotherapeutic services for adolescents as well, so 14 to 25 as well. And I don't think that gets recognised as much at times, that there is quite a variety of services available to young people. In saying that, I know again they're not emergency services, but there is kind of a vast quantity of professionals trying to help young people in the area of Limerick. One thing that might be relevant from Jigsaw on a national kind of level is Jigsaw. So we're in the process of developing an online platform for mental health support, which obviously would be more available and flexible in terms of times and that kind of thing. That's in the pipeline over the next year too. That 12 to 25, that kind of adolescence transitional period is the area that we focus on, and we do know that young people in that age group do spend a lot of their time online, and likewise it's helpful in terms of access, because there isn't a Jigsaw in every county in Ireland, but we would hope in the long term that it will be accessible to anyone in any county in Ireland.
Obviously, social media plays a massive role in the lives of young people today. How much of this is impacting on their mental health, and what can parents do to support their children?
I know that there's a kind of a public kind of negative bias at times towards social media. What young people are telling us actually is that it's very supportive for their mental health, and that they use it to connect an awful lot of it, and it's a real protective factor for them. So while clearly an awful lot of screen time can be difficult for anyone, we do see the positive sides of it as well, and that's why we're trying to engage with that side of things. You know, young people are going to be online, they're going to be on social media, we need to be there and support them where they're at. Well, a big part of our Jigsaw bid is going to be around parents actually, and parent education, and offering supports to parents and other professionals as well. The big thing about, I guess, education about social media and online is that a lot of parents are on social media and are online themselves, but the difficulties that we face online are very similar to the ones that we face in our day-to-day as well, in the physical realm. So sometimes it can be a bit magnified maybe online, but it's the very same in terms of the difficulties that young people are faced with, similar pressures, similar relationship difficulties. We offer workshops, like day-long workshops in Jigsaw, and there's a level 1 and a level 2, where we're really trying to build the capacity of parents, teachers, professionals, volunteers who work with young people all the time, and so trying to upskill them, educate on mental health of young people and that kind of thing. Also, we have a massive schools aspect to the work in Jigsaw, where we're really trying to ingrain our work in schools and to support teachers in terms of young people's mental health as well. So there's a big framework in development there as well. And we're already in schools quite a lot. We've been to many of the schools in Limerick with workshops for the young people during the day, and then we try to, in tandem with that, offer workshops to the parents in any given week, the parents of the school that we've been to. So again, it's around supporting their young people and education around what helps.
Oftentimes teachers are educating their students on how to maintain a healthy body and a healthy mind. What can we do to involve parents more and educate parents on promoting positive mental health?
We're kind of eminently aware that teachers are already being asked to do a whole host of things on their day-to-day, and then to be adding mental health and mindfulness on top of that is not going to be particularly helpful when they're already overburdened by the amount of things that they already have to do. So what we are trying to do and what's in development is around being more of a support to teachers rather than being a pressure. So what we want to do is help in terms of that education piece. But we have noticed that from school to school it can be a variable number of parents that show to the parenting workshops in the evenings. We don't see that as maybe a fair reflection on the parents. It's more looking at our responsibilities and ways that we can tackle that and meet parents where they're at as well, because if they're not showing up, that's probably for good reason, and it's something that we need to tackle and support as well. Then what we did last year was meet with all the guidance counsellors in Limerick and let them know of our service and offer our support as we could. And as for having a kind of a mental health specific support in schools, I know that some do in the country. I'm not so sure about Limerick, but again, as part of our kind of framework for engaging with schools and supporting schools in supporting young people's mental health, we are trying to get in there and to see what the best way of doing that is and what teachers and guidance counsellors need and are looking for. So we don't operate like a waiting list. If you ring up and get an appointment, you'll be given the date and time of your appointment at that phone call. At the moment, our service, the waiting time is about 6 to 7 weeks because we've been slightly understaffed over the first year, but we are getting a new staff member in the next couple of weeks. We're a charitable organisation and young people can access the service for free. Individual sessions are free. We also do workshops in schools and community-based workshops as well. So yeah, it's entirely free. We try to be as accessible as possible, so there's a number of different ways of referring. You can call up and make a referral yourself and make an appointment. Parents are actually our highest number of referrers. We also have self-referrals, and we do get referrals from GPs and other professionals as well. People can refer by email, phone, or they can call in to the service and make an appointment as well.